discuss about congestive heart failure and cardiomyopathy. Heart failure is an abnormal clinical syndrome involving impaired cardiac pumping and or filling. It is the terminology preferred today because not all patients with heart failure will have pulmonary congestion or fluid overload. It is associated with numerous types of cardiovascular diseases, particularly long-standing hypertension, coronary artery disease, and myocardial infarction. It is characterized by ventricular dysfunction, reduced by exercise tolerance, diminished quality of life, and shortened life expectancy. Cardiomyopathy, on the other hand, is defined as a disease of the myocardial muscle fibers. The disease results in progressive structural and functional abnormalities of the myocardium. All types of cardiomyopathy can lead to cardiomegaly and heart failure. In Canada, it is estimated that there are 500,000 people living with heart failure and 50,000 new cases are diagnosed each year. Depending on the severity of symptoms, heart dysfunction, age, and other factors. Heart failure is associated with high rates of mortality and economic costs. Women comprises 51% of all new cases. Readmissions to hospital are common, as many as 50% of patients with heart failure are admitted within 1 year. Nursing process is a systematic approach used by nurses to render care for patients. It encompasses 5 steps: assessment, diagnosis, planning, intervention, and evaluation. In this video, we apply this process in caring for Mrs. E, a 70-year-old woman who was admitted to the medical unit with complaints of increasing dyspnea and exertion.
Good morning, Mrs. E. My name is Jessica. I'm one of the nurses in the medical unit, and I'll be your nurse till 4 p.m. today.
Good morning.
Is everything okay?
Yeah, I suppose.
I have some questions to ask you about your reason for being here, but before I do that, I'd just like to remind you that all of the information you give us will be kept confidential. The only other people who will see this information are the other staff of the health team. So right now, I just want to ask you a few questions about your health status. This will help the team make a care plan for you.
Sure.
So,
Okay.
so can you tell me why you were admitted this morning?
I am having difficulty of breathing, especially when I'm lifting something.
Oh, okay. When did you start experiencing this?
I've been experiencing this for 2 years now.
2 years. Have you noticed any other symptoms such as nausea and vomiting?
No, but I can sleep without elevating my head with 3 pillows.
I see.
And at night, and my legs are swollen 2 weeks ago.
I see. Have you been diagnosed with anything?
Yes. I had a severe heart attack at the age of 58.
Do you have any history of respiratory infection?
Well, I had a frequent cough, and I noticed that I cannot walk 2 blocks without catching my breath.
Okay. You mentioned earlier that you had a severe heart attack at the age of 58. What prescription medication are you currently taking?
Oh, I don't remember the name, and sometimes I forgot to take my medications.
Okay, so now I'm going to do a physical examination. I'm going to check your vital signs, and then I'm going to examine your chest, and also I'm going to listen to your heart. Would that be okay with you?
Yeah, that's fine.
Okay.
That would be a good idea.
Well, if there's anything else that you need to make you feel comfortable, don't hesitate to tell us, okay? And here's the call bell. Whenever you want to get out of bed, just use it so that I can come in to assist you.
Thank you, you're a great help.
No worries.
Hi, Nurse Jessica. How are you doing today?
Hi, Dr. Prince. I'm good, thanks. Yourself?
I'm good. So, how is Mrs. E doing today?
Mrs. E, here's her chart.
Okay, thank you.
How's Mrs. E? Let's see. Well, she's in respiratory distress, and she's using her accessory muscles to breathe. Her
Okay.
respiratory rate is 36 breaths per minute. Cyanotic lips and extremities observed. Skin is cool to touch and diaphoretic. She also has heart murmur and moist crackles in both lungs. Also, we just received her chest x-ray results. I put everything in there. You can just see there. It revealed cardiomegaly with right and left ventricular hypertrophy. And also it has fluid in lower lung fields.
I see. So, give her Vasotec 5 milligrams per RM every day and digoxin 0.25 milligrams per RM as well every day. And Lasix 40 milligrams IV 2
IV.
times a day.
Okay.
And I want you to increase her oxygen 6 liters.
6 liters?
Yeah.
Okay.
So can you also get 12 lead ECG for me and
Okay.
extract cardiac enzymes 3 times every 8 hours.
Sure.
And
Okay.
you should also stay in 2 grams sodium diet. Okay?
Okay.
Okay.
Should we monitor her weight?
Yep.
Okay.
And here's your chart.
Thank you. Okay, after gathering all the pertinent information, I am going to formulate my nursing diagnosis. My priority is impaired gas exchange related to alveolar capillary membrane changes as evidenced by increased respiratory rate, shortness of breath, and dyspnea on exertion. My expected outcomes would be that the patient demonstrates improved gas exchange within 24 to 48 hours, evidenced by the following: effortless breathing, improved respirations, absence of cyanosis, lungs clear on auscultation, oxygen saturation levels within normal limits. I will assess and monitor for changes in respiratory function to detect signs of impaired ventilation and perfusion. I will monitor arterial blood gases or ABGs to identify hypoxia or hypercapnia. I will auscultate lung sounds every 4 hours to detect increases in congestion. I will monitor chest X-ray examinations for changes. I will elevate head of the bed, have the patient lean forward, reposition every 2 to 4 hours as indicated to optimize ventilation and gas exchange. I will administer oxygen therapy to maintain arterial oxygen saturation above 90%. I will instruct patient to cough and breathe deeply to facilitate ventilation and remove secretions. I will administer medications as ordered. Hi, Mrs. E. I will just give you some health teaching about your medications, your diet, and how to weigh yourself, and also the importance of reporting the symptoms immediately to the healthcare provider.
Nurse Jessica, this is my daughter Maribel.
Oh, hi, Maribel. It's nice to meet you. It's good that you're here because you can learn the content of the teaching and you can assist your mom with compliance.
Okay, as long as I will be a great help for my mom.
That's great. So I'll start off with the diet. The doctor ordered a 2-gram sodium diet to help improve the swelling on your legs. Basically, this means that it's best for you to avoid foods that are high in sodium, like processed foods, cheese, bread, cereals, condiments, and fast food. If you want, I can set you up an appointment with a dietitian so that she can give you more options.
That will be great.
If you have any difficulty remembering to take your medications, we can develop a specific routine such as checklist or a pill box. What do you know about your medication?
It will help me with my breathing and my heart rate.
I think my mom needs to be aware about the importance of taking her medication.
Okay, I will teach you and your mom why the medication is needed and how it works. I will identify some side effects that will minimize your anxiety if these untoward effects will occur.
That would be great. Thank you.
Do you have any more questions?
What about drinks? Does drinking plenty of water help?
That's a good question. As for fluid intake, it's recommended if she drinks no more than 6 to 8 cups per day to prevent putting too much work on the heart and prevent weight gain.
Oh, okay, I got it.
Hi, Nurse Jessica.
Hi, Dr. Prince.
So, how is Mrs. E doing?
Here's her chart.
Thank you.
She told me that she feels much better now, and her blood pressure is 120/80. She's not having a hard time breathing anymore, and her weight is constant from last week. There were no reported respiratory distress, and her respiratory rate decreased from 36 to 22.
Continue monitoring her vital signs and let me know if there's any changes. Okay?
You bet. Okay.
Here you go.
Thank you. Did I meet my goals? What did I learn in this situation? What would have I done differently next time?
After finishing the outcome evaluation, examine the plan of care to see if it needs to be changed. You will probably modify the plan if the client's condition changes or if the health goals were not met. In evaluating a plan of care, you need to do 2 things. First, draw a conclusion about the status of client's problems. Second, review each step of the nursing process and the manner in which it was performed.